Alright, so part 3, let's finish up with the urinary system and urinary physiology. We have 2 kidneys, 2 ureters going from the kidney to the 1 urinary bladder, and 1 urethra going out. The male urethra is between 6 to 8 inches, and the female urethra is about inch and a half. What is the imaginary area from inside the urinary bladder formed by the 2 openings of the ureter and the 1 opening of the urethra? Triangle called the trigon. Okay? Very good. We also, when we talk about the kidneys, the outer kidney has an area around it that is thin. What's that called? The renal capsule. If we cut the kidney open, the outside area is called the renal cortex. The inside area is called the medulla. And let's name some medullary structures. We have pyramids, we have columns, and as a whole, the renal sinus is made up of 3 parts, which are made up of what? Minor calyx, major calyx, and the renal pelvis. The whole, as a whole, is called the renal sinus. Okay? What is the area called where things enter and leave the kidney? That is the renal hilus. And the 3 structures in the renal hilus are the ureter, renal artery, and renal vein. When we talked about the pulmonary system, the same thing is true for things entering and leaving the lungs, called the pulmonary hilus, and in that we have the primary bronchi, or the mainstem bronchi, along with the pulmonary arteries and the pulmonary veins. Okay? Very good. When we talk about the functional unit of the kidney, what makes the kidney work? The nephron. The nephron is made up of 2 parts. What are they? The glomerulus and the renal tubular systems. The renal tubular system is made up of the proximal and the distal convoluted tubules and your collecting ducts. The collecting ducts run through the pyramid, and what is the tip of the pyramid called? The papillae, and that's where urine is dripped into the minor calyxes, the major calyxes, the renal pelvis, and then out the ureter. Very good. What is interesting about the glomerulus? The Bowman's capsule around the glomerulus is fed by an artery, is drained by an artery. The afferent artery is bigger than the efferent artery, creating a high pressure system, causing filtration to occur at the glomerulus. And then your efferent arterial branches off into peritubular capillary beds that comes in contact with the proximal and distal convoluted tubule, where we have secretion and reabsorption occurring. Remember, this is under influence of hormones, whether it's mineralocorticoids or antidiuretic hormone. It's going to tell your body what to absorb and what not to absorb. Okay, more water, more salts, things like that. Okay, that's all you really need to know for the nephron. Can we have stones in our kidneys? Those are called kidney stones, also called renal calculi, also called nephrolithiasis. Will that cause blood in the urine? Yes. And blood in the urine is one of your abnormal findings. So an abnormal finding of blood, would be blood in the urine, which is called what? Hematuria. Can we have protein in the urine? That's called albuminuria. Can we have ketones in the urine? Ketonuria. Can we have urobilinogens? Can we have white blood cells? Can we have pus? Can we have nitrites? All these are abnormal findings of urine. What are normal findings of urine? In order. Water, urea, sodium, potassium, phosphate, sulfite ions, creatine, and uric acid. Very good. He wants you to know those in order. Typically on the practical, name 4 and name 4. 4 abnormal, 4 normal. When we talk about normal, what is a normal range of specific gravity? 4.5. Specific gravity. 1.001 to 1.030. What is the specific gravity of distilled water? 1.0000000. What is your normal range of urine, pH? 4.5 to 8.0. What is the average range of your pH? Or what is your average pH? 6. Normally, urine is slightly acidic. What gives urine its color? Urochromes, which come from the breakdown of hemoglobin. Because remember, red blood cells don't last forever. Why? They have no nucleus. They can't divide. They can't do mitosis. They have to wear out. How long do they last? 3 months, I think. About 100, 120 days. About 4 months. Okay? What else do we talk about regarding urine? It's supposed to have a fresh smell. It's supposed to not smell foul. When you look at it, it should have a slightly yellow or amber color. It shouldn't be black. It shouldn't be red. It shouldn't be clear. It should have a slight color to it. Was that all we really did for urine? I think that's about it. All right, you guys do great in your practical. Good luck.